It all starts with odd symptoms. Your face goes numb, your arms get heavy, or in the middle of a conversation, you start slurring. That's how a stroke unfolds. It's important to know the warning signs of this brain attack. When you're having a stroke, every second counts, and what you or your loved ones do in those critical moments can help you recover and save your life. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Joining us on the program are Dr. Jericho de la Cruz. He's a physical and rehabilitation medicine specialist and a member of the Philippine Academy of Rehabilitation Medicine. We also have Dr. Jose Miguel Medrano. He's a neurologist and neurocritical care hospitalist at St. Luke's Medical Center. It's good to have you both on the show. Now, I'll start first with Dr. Medrano. Let's talk about what a stroke is. It's an odd name for a medical condition, but I suppose it comes from the idea of receiving a sudden strike or a sudden blockage or an occlusion. And that's what happens when someone gets a stroke, right, doctor?
Yes, so actually a stroke is, in simple terms, a brain attack. And it's a very sudden and acute event. So it's something that can occur out of the blue and occur very rapidly and cause a lot of symptoms immediately.
Yes, and are all strokes the same for every person, or are there different types of stroke? Still with Dr. Medrano.
A stroke is a very unique phenomenon for each and every patient. There are what we call certain stroke syndromes, where a certain set of patients, depending on the blood vessel affected, would have a similar set of symptoms, but everyone has a different severity and has a different reaction to the recovery of stroke. And in general, you have two major subtypes of stroke. The first being a blockage in one of the arteries of your brain, or what we call an ischemic stroke. And the second is when you have a rupture of a blood vessel, which is what we call your hemorrhagic stroke, which is separate from your aneurysm, which is a different form of stroke altogether.
Okay, now let's talk about gender and stroke. Does being a man or a woman affect one's risk of having a stroke, Dr. Medrano?
So there's actually a lot of geographical disparities with this. So in some areas, the stroke rates are more equal between men and women. But in developing countries, men are more often affected at younger ages, have more severe strokes, and have a tendency to recover more poorly.
Dr. De La Cruz, what's the prevalence or occurrence of stroke in women naman?
Like Dr. Medrano said, it depends on the age of the women. The tendency of having a stroke in women tends to be higher during the postmenopausal age.
Okay, so there are certain factors that will predispose a woman when it comes to brain attacks or strokes. Now, how about men naman, mga lalaki naman, Dr. De La Cruz? Mas marami ba ang kaso ng stroke sa kalalakihan?
With regards to gender, it doesn't really, it's not really a risk factor. The risk factors are, number one, your family history. Number two, if you have stroke patients who have relatives na nagka-stroke na before, the tendency is you can have a stroke again. If you have parents, relatives who have a stroke, the tendency is you can have stroke as well. You have the modifiable factors, like if you have illnesses like your hypertension, diabetes, hypercholesterolemia, or obesity. Your lifestyle can contribute to you having a stroke. If you live a very stressful lifestyle, you eat unhealthy, if you eat lots of saturated fats, or if you drink a lot, and if you smoke.
So we'll take a quick break, but when we return, we'll talk about how to reduce one's risk of having a stroke. You're watching MedTalk Health Talk right here on CNN Philippines. This is Med Talk Health Talk, and I'm Dr. Freddy Gomez. Let's talk about the onset of a stroke. A lot of us might be confused if it's a stroke or something else, lalo na kapag bata ka pa. And when I say bata, I mean 45 years older or younger. Now, Dr. Medrano, what happens in the first few minutes of a stroke attack? Ano ang parte ng katawan natin na agad na naapektuhan?
So, katulad ng sinabi niya po earlier, yung most common symptoms would be weakness of one side of your body, facial drooping, or slurring of speech. That's common for both types of stroke, whether it's ischemic or hemorrhagic. But the hemorrhagic type of stroke, you often have also symptoms of very severe headache or vomiting, or a decrease in your wakefulness, so you become very drowsy and difficult to wake up. Other symptoms that can occur that we now recognize as very common in stroke is problems with balance and even problems with vision, particularly if you lose vision in one eye or if you have a doubling of vision or parang dumodoble talaga yung paningin natin.
So those symptoms are definitely something for our viewers to be aware about. Now, it doesn't mean that all of these symptoms may be present or you may just have just a few of them and they still could be a risk for a stroke. Now, Dr. Medrano, when a person experiences any of these symptoms, what's the first thing that should be done? Gaano ka importante ang oras sa mga sitwasyon na ganito?
Okay, the first thing na any stroke patient or any stroke suspect should do is call for help. Ang hirap po kasi if you're alone and there's no one there to assist you in going to a medical facility. Now, there are some patients na their symptoms will improve rapidly within the next few minutes, but and in what we call a transient ischemic attack. But they should still go to a hospital as soon as possible for evaluation. Because sometimes what we have is a warning symptom, and then after a few minutes to hours, the symptoms recur and they become permanent. So the first thing, call for help and immediately go to a hospital for evaluation.
Punta naman tayo sa mga risk factors of a stroke. Dr. De La Cruz, does lifestyle have anything to do with it? Or as you mentioned earlier, genetic really has a small role in this. And you touched a little bit about how lifestyle does affect this. Could you expound on this a little bit more?
Yes, because if we live a very unhealthy lifestyle, the tendency of developing other diseases that could contribute to stroke increases as well. For example, kung hindi ka maayos kumain, you're full of saturated fats. The problem is you become obese, you become overweight. The tendency is you can develop other diseases like hypertension, diabetes, which contributes to the increase in the risk of having these accidents, the cerebrovascular accidents that we can prevent.
Okay, and about 4 out of 5 strokes are preventable. So knowing the risk factors and adopting a healthy lifestyle are the best steps one can take to prevent a stroke or a brain attack. Now, Dr. De La Cruz, we all know the importance of having a healthy lifestyle. But what is it specifically that our viewers should know that they should follow or change for that matter in order for their risks of having a stroke to be lessened significantly?
Okay, so number one, if you're a smoker, you should quit. Number two, if you're a drinker, you should limit your alcohol intake. So the recommendation is for women is just 1 glass of wine a day, and for men 2 glasses of wine a day. You should eat healthy, low fat, low saturated fat, low sugar. You have to do exercise. Us in the rehabilitation medicine profession, we espouse exercise as medicine. So hindi lang stroke na napiprevent ng exercise. Marami pang diseases na napiprevent ng exercise. So if we do regular exercise, about 150 minutes a week of cardio exercise plus resistance exercises, you tend to decrease your chances of having these illnesses and eventually stroke.
And that's something that's good to know. Like what you said, smoking, definitely cut that right away. Alcohol, maybe a moderation is acceptable. But how soon, if there is someone who is in their 30s or 40s who has not been healthy all their lives and decides to do so, will they still have a chance of reducing the risks for stroke?
Of course, no. We have to decrease this. If you stop early, of course, the tendency of developing a stroke decreases significantly.
Okay, and the effects of a stroke can be disabling. But given time and if treated immediately, there's a very good chance that a patient will recover any lost functions. More on this after the break. There is life after a stroke. With time, new routines can be second nature, and rehabilitation can build one's strength and capability. Now, Dr. Medrano, what are the effects of a stroke?
The immediate effects of a stroke are the symptoms of weakness, numbness, and long-lasting disability. And these things can be mitigated by early treatment in the hospital. So, one of the biggest advances in medicine in the past 20 years is that we've developed the capability to thrombolize patients with ischemic stroke, and that improves the chance of recovery 6 months later on significantly. Now, other things that can happen in stroke patients are pwede po sila mag-develop ng pneumonia, especially kung may difficulty of swallowing po yung patients. Pwede din po sila magkaroon ng post-stroke epilepsy in less than 1 to 5% of patients over the next few years. And a lot of patients can also develop a vascular dementia, especially if they have repeated or recurrent mini strokes. And all of these things are preventable by controlling your stroke risk factors.
Okay. Now, doctor, you mentioned mini strokes. Could you expound a little bit more on this? Is this similar to what a lot of people might think of as a mild stroke, if there is such a thing?
So it's different from what we call the severity types of stroke. Mini strokes are usually referred to small vessel stroke problems, and they usually have very, very mild symptoms. And in some cases, you don't even detect that you've had these kinds of strokes until you do an MRI or CT scan imaging, and you can see what they call um, these dark spots in your brain. And they're often called silent na strokes po, but they do have an effect over time, especially if they've built up a significant number of these.
Okay, I mentioned that because there have been late reports on this being one of the symptoms associated with a prolonged onset of COVID-19.
COVID-19, as we've recognized, is not just a pulmonary disease. It's a disease that affects your blood vessels and your coagulation, the way that your blood parang clots, especially within the blood vessels themselves. So pwede magkaroon ng maliliit na strokes all throughout the brain and all throughout the body. You can have vessel problems, and that's one of the reasons why COVID-19 is such a uh, deadly disease that we're learning more about and treating better.
That's right. Now, stroke rehabilitation is an important part of stroke recovery. But what actually takes place in a rehab therapy? Dr. De La Cruz, could you give our viewers an idea or a glimpse of what goes on in a rehabilitation routine?
So rehabilitation therapy during the stroke patient's admission, it's a whole gamut of things. No? Hindi lang isa. No? It's a group. So it is composed of a psychiatrist, a physical therapist, an occupational therapist, a speech therapist, a psychologist, and a nursing rehabilitation aide. So what happens is depende kung ano yung deficit ng pasyente. So kung hindi nakakalakad, hindi nakakatayo, hindi nakakaupo, no, yun yung ina-address natin, yung lakas, no. We have to bring that back. We have to mitigate the functional limitation of the patient. And another one is if you go to the discipline of occupational therapy, it's more on the ADLs, what we call the activities of daily living. Can the patient bathe? Can the patient eat? Can the patient dress himself? No.
Okay. Now, Dr. De La Cruz, when should stroke rehabilitation begin? And how long? Because marami talagang factors like what you mentioned, no? It's a whole team trying to make sure that you as a patient will get better. How long does this usually last?
Okay, so usually it starts if everything is stable and there's no contraindication, we could start as early as 24 hours post-stroke, post-ictus. And then the recommendation is you have to have a structured physical therapy program for the next 6 months. So the next 6 months is what we call the golden period.
What about post-stroke depression? Dr. De La Cruz touched on this very briefly. Is this common among those inflicted by a stroke?
So it's actually surprisingly very common. And it actually varies depending on two things. First, the area of your brain that's affected. So may mga areas po na kapag natamaan ng stroke, mas pwede magkaroon ng depression. And the second is yung deficits po natin or yung symptoms na natitira. Siyempre po, if you're previously very functional, capable of doing things by yourself, and then you lost that ability, it can really parang prompt depression and develop a patient's or loss of worth or loss of independence. So post-stroke depression actually is improved by a multidisciplinary approach. It's not just a neurologist helping these patients out. We do ask our psychiatrists for help. We ask our therapists and our behavioral therapists for any treatment that they can give or therapy so that they can get through their issues. And another major issue is that oftentimes the people who take care of our stroke patients can experience caregiver fatigue. We also have to address the family members, yung mga loved ones ng pasyente natin, and take care of their mental health and well-being so that they can take care of our patient better.
That's good. Now, before we wrap up this episode, do you have a short message for our viewers with regards to preventing strokes? I'll start first with Dr. Medrano.
So, to prevent a stroke, you have to control your vascular risk factors. The most common risk factor pa din until now is hypertension, diabetes, smoking, obesity, and the newer risk factors actually include a very stressful lifestyle, very poor sleep quality, especially if it's linked with sleep apnea, and a very poor diet, especially diets low in fruit and high in salt and high in fat. If you have the symptoms of stroke, again, go to the hospital immediately. Yun po yung pinaka-importante na pwede natin gawin kasi yung management ng stroke ay pwede lang gawin in a short, parang golden period or a fixed time. And if you appear at the hospital within that time frame, yun po yung pinakamagandang pwede natin, yung pinakamagandang setup natin sa patients.
Very good. And I will end this with a message from Dr. De La Cruz.
Okay, usually stroke changes everybody's lives. It's not just the patient, it includes the family members. Nag-iiba yung dynamic ng family. So, like what was said, that it depends on the disability and the impairment. So, hindi lang yung patient ang tinitreat, yung family na rin. They have to overcome the impairment, the disability, so that they can move forward and live their new normal, so to speak.
Very well said. Strokes can be scary. One moment you are having a normal day, the next day you find yourself losing your speech and other brain functions. There are so many things that you can do to help avoid having a stroke, and that includes changing to a healthier lifestyle. And with that, we'd like to thank our guests, rehabilitation medicine specialist Dr. Jericho De La Cruz and neurologist Dr. Jose Miguel Medrano. Thank you for watching our show today. I'm Dr. Freddy Gomez. Stay safe, everyone.